Hi, this is Dr. Tayani from the Tayani Institute, ophthalmologist and oculoplastic surgeon. I'm here to also introduce my colleague, Dr. Stephanie Mulick, who's one of our optometrists at the Tayani Institute.
Hello.
Today we're going to talk about clear lens extraction. It's a lot of words. I'm going to kind of back into this a little bit broader topic and then come into it. So, Dr. Mulick, you and I both see a lot of patients from all ages, right?
Yes.
From birth to the end of life.
Yes.
And there are patients who come in for LASIK. They want to get rid of glasses because they're younger and they're just tired of wearing glasses. Or we see a lot of patients who have cataract diagnoses that want to have cataract surgery, get rid of their blurry vision and see better. And then we've got this interesting category that are between the 40 to 60 something year old that don't really have a cataract, want to get rid of glasses, or they're now in that presbyopic age where, you know what presbyopia is? Can you tell us what presbyopia is?
Sure. Presbyopia happens when we get into the age of about 40 to 60. It happens when the lens inside of the eye starts to thicken, and it causes us to lose our ability to focus up close.
Right, so those patients, if they were nearsighted or farsighted before and now they're presbyopic, they've got additional problems, or they never wore glasses and now suddenly they are wearing glasses because of the whole loss of accommodation or presbyopia. They don't like it. They don't want to wear glasses. So just the other day, we got a call from in our office saying, I'm a 62-year-old female and I don't want to wear glasses. What are my options? So what would you say?
Well, their options could be LASIK, but they're still going to probably need reading glasses, or they would need one eye for distance and one eye for up close. So a great option that Dr. Tayani was talking about is called clear lens extraction.
Yeah, so clear lens extraction is basically clear lens extraction, right? It's the same as cataract surgery. However, we call it clear lens extraction because a cataract is when the lens of the eye is no longer clear. It's opaque. That's what the cataract is. But a clear lens is a normal lens. It's clear. You can see through it, but you need glasses to see better because of either the eye is nearsighted or farsighted or presbyopic. So the beauty is we can get rid of the glasses and put in a specialty lens, a multifocal or an accommodating lens where we can see everything from near to computer to distance. The sort of challenge is we're taking a normal, healthy eye and subjecting it to surgery, which is one of the reasons that we don't necessarily say, hey, everybody come on and do this instead of glasses or contact lenses. But if you don't like to wear glasses, you don't want to wear contact lenses, or you're not able to tolerate, can you give us some scenarios where patients, because you see that all the time?
Sure. Some patients who have extreme dry eyes can't tolerate contact lenses. Some patients who are very active and they don't want to wear glasses, but just can't even get a contact in their eye. Those are other patients who would be a great candidate. Or patients who have overworn their contact lenses. And really, I'm not recommending them to wear contacts anymore, but they just don't want to wear glasses. Those would be great candidates as well.
But again, so let's say we've gone through all of this analysis and scenario, and patient is better off with the clear lens extraction as opposed to LASIK, or if they actually have a cataract. Bottom line is we can now implant a lens that is a multifocal lens that allows us to see everything from near to computer to distance without the use of glasses. It's a great technology. The surgery takes about 7 to 10 minutes to do, painless. You see right away. The postoperative care, in one of our videos, we've talked about that with the cataract surgery. It's exactly the same. And I welcome you to open that YouTube channel and look at it. Do you think anything else we should talk about on this, or did we cover it?
I think one thing that you do want to know is if you are going to do clear lens extraction, it does work best when you have both eyes done. I've had patients go and do one eye and never come back for the second eye, so you're not going to get as good of results if you don't do both eyes.
Very good. Well, again, this is Dr. Tayani and Dr. Stephanie Mulick from the Tayani Institute. Till next time.